All right, hi everyone. My name is Madhu. I'm a second year medical student at the University of Wisconsin-Madison, and today we're going to be talking about MEDiC. And we have two people here with us who are part of the MEDiC exec board. If you guys want to introduce yourselves.
Hi, everyone. My name is Thean. I'm the Director of Development for MEDiC, and I'm a first-year medical student here at Madison.
Hey everyone, my name's Jarrett Jones. I'm a first-year medical student here at the University of Wisconsin as well, and I serve as the Director of External Operations and Patient Advocacy here with MEDiC.
Awesome. It's great to talk to you guys. I was hoping, Jarrett, you could tell us a little bit more about MEDiC in general.
Yeah, so MEDiC is a system of student-run free healthcare clinics operated by students who are enrolled in health professional programs here at the University of Wisconsin-Madison, of course, with the support of local volunteer physicians. And from coordinating day-to-day, clinic logistics to connecting patients with long-term care, MEDiC is truly student-run. And currently, we operate 4 unique clinic locations. Southside Clinic runs every Saturday. And provides acute or urgent care to diverse populations. MEDiC Mental Health operates twice a month and prescribes or provides short-term psychiatric prescribing. The Salvation Army Clinic takes place at the Salvation Army Women's Shelter every Tuesday night. And then the Michelle Tracy Clinic focuses more on preventative medicine through monthly health education clinics, focusing on a wide variety of topics. And our volunteers are also involved at 3 other clinics, though those are not directly operated by MEDiC. So I guess that sort of encompasses the current state of MEDiC, though we're always looking to expand to provide more resources to our patients in our area.
Great. That was an awesome overview of what all MEDiC is. And I was hoping, Thean, if you could tell us more about what you see as MEDiC's role within the communities that it serves.
Sure. MEDiC provides this bridge in medicine for a lot of our patients. A lot of our patients aren't able to access primary care providers or get into clinics around Madison. And because those issues with inaccessibility, they're able to come to us first if they need any medical care. And because we involve health profession students on campus, including medical students, PAs, PTs, nursing students, were able to provide everything from education to general medicine to physical therapy and mental health care. And whatever we can't do, we're able to refer them out as well.
Jarrett, could you tell us more about the patient populations that these MEDiC clinics serve?
Yeah, definitely. So like I said, I think operating several different unique clinics gives us a chance to meet a lot of different diverse populations, sort of where they're at. Southside Clinic serves a wide variety of patients from who live in Madison and patients who commute, some of which are immigrants or refugees. In the Salvation Army Clinic, I know I mentioned, happens at the Salvation Army Women's Shelter. So this helps to serve women who are currently suffering from homelessness. And then our other clinics just work closely, I would say, predominantly with populations of both men and women suffering from homelessness within Madison.
All right. And Thean, if you could tell us more about who is able to access these MEDiC clinics and how do patients make appointments if they're interested in being seen at one of those clinics?
The MEDiC clinics are accessible to everyone because they're walk-in clinics, and we're open throughout the week, and they're able to just come in wherever we are. And sometimes we even come to them, for example, at the Salvation Army Clinic, where we're already meeting them where those patients are located. In addition to the walk-in clinics at Southside, you're able to call and make an appointment as well.
Awesome. And Jarrett, you talked about how MEDiC clinics are sort of more acute care based. How does MEDiC help connect patients to more longer term care within our community?
Yeah, that's a really good question, and I think an important one because I think sort of that bridge to care that Thean was talking about earlier is really important. And actually, since 2021, with the support of UW Health, MEDiC's been able to provide primary care referrals for uninsured patients to access community health centers in Madison. And yeah, so the work of our referral coordinators is so important because it allows MEDiC to help our patients in our community even after they've left our clinics. And a vast majority of the patients that get referred to Access do go on to establish primary care at those clinics.
Yeah, that's wonderful because I know it can be very hard to make appointments at Access and get connected. So, Thean, could you tell us more about some current projects that MEDiC is working on?
Sure. There's a ton of projects that we're always working on. Some of them are recurring that we do every single year, and some of them are brand new and things that we're trying to implement now. And one of the ones that I'm really passionate about and excited about is our current project, which involves getting our volunteers and leaders to make their own changes within MEDiC. So because of the generous donations of grants and various funding for MEDiC, we're able to allocate funds to allow students to design their own projects and implement them. So we've created this mini grant application, which allows for students to propose things that they've seen in MEDiC and find a way to change our healthcare system that we created so that it can better serve our patients. And this project will hopefully be sustained in the future so that we can continue to make changes and do something based off of the observations that we've seen in these clinics and get volunteers more involved.
Yeah, that sounds like a great program, especially for volunteers working within the clinics, and they're able to see how things work and directly impact the care of patients there. Jarrett, could you talk to us more about some of the healthcare gaps that MEDiC helps to fill?
Yeah, it's a good question. And I think the short answer is that there are many that MEDiC helps to fill. I think a big one is one that we've sort of talked about so far, but I think it's a really important one in that it's that access component. And I think really just the bridging to long-term care, not just, treating an acute problem, but then providing the patients with resources to, local food pantries or different shelters that they can stay at, or like we said with the access referrals, getting them, sort of integrated into the healthcare system and with more consistent follow-up with a primary care physician. I think that's a really good one that MEDiC helps to support its patients with.
Awesome. And Thean, could you tell us some of the challenges that you have faced, maybe as an exec board or as a council, running a free healthcare system that is primarily student run?
Of course, there will always be challenges. I think the main thing for us is that since it is completely student run, it really depends on the enthusiasm and the dedication of our volunteers to keep these clinics running. And this involves a lot of hours, time, commitment, energy, and we really can't thank our volunteers enough for all the work that they do, despite all the challenges we have, just because we're all students and we're all learning about this health system together and trying to make all these changes happen to better the environment and healthcare access for our patients. They're able to step up and make the best of everything. And that's why we're still here and how we're able to continue improving.
Awesome. Thank you for telling us about MEDiC. I really appreciated the very comprehensive overview. And I also want to thank you guys for being a part of MEDiC and helping the community in that way. So, all right.
Yeah, of course. Thank you.
Thank you.